About 6 years ago, my son got so sick from Lyme disease and other tick-borne illnesses that I really didn't think he was going to survive. So the initial physicians, including myself, who saw him and evaluated him, had absolutely no idea what to do for him. So essentially, I wrote the book that I wish I had when my son first got sick. And it wasn't that there wasn't enough information out there. There were thousands of articles and books and things about Lyme, but much of the information was either contradictory or confusing or very complicated. So I sorted all through that, and I wrote the book that I was hoping that doctors and patients could just pull off the shelf and know what to do next for these patients. I think this task force has the opportunity to develop the premier program in the United States. I've worked with legislators in Canada, in the U.S., in both federal level and in various states, and I think Delaware has the most momentum and the most dedicated congresspeople. So I'm very optimistic that something is going to be done that's going to help these patients. I mean, the reason there needed to be a task force is because there were so many patients that weren't getting the kind of diagnosis and treatment that they needed. Many of them who clearly had Lyme disease were being told that they didn't. So there were long delays in them getting appropriate treatment. Lyme is actually a very new disease. It's been around for thousands of years, but we didn't recognize it as such. We didn't make the connection between the tick, the bacteria, and the disease until the 1980s. So we have a very small database. Then there's been so much controversy around it. First, the rheumatologist said it was their disease, then the dermatologist said it was their disease, then infectious disease people stepped in. So we don't have a real solid collection of data. So when a disease is new, you have to go by anecdotal cases. You can call them anecdotes, but you can also call them case studies. And many case studies are published in peer-reviewed journals, and you can learn a lot from a case study. And I think our best evidence base is all these patients that show up here and tell their stories about how they've had Lyme for 10, 15, 20 years and had been misdiagnosed for a long time. And one thing we know for sure about Lyme disease is that the longer the interval between the initial infection and appropriate treatment, the less likely there is to be a positive outcome. So the sooner you're diagnosed and appropriately treated, the better chance you have. I think that this task force is going to be on the right side of history. I mean, Lyme disease, unless we get very aggressive about it, isn't going away anytime soon. And you're going to be seeing more and more and more cases and more people coming in and saying we need educated practitioners that can deal with these cases. I don't think it does any good to educate the public if they go into a healthcare provider who says you don't have Lyme disease, or it's all in your head, or if you just tried harder, your symptoms would go away. So I think it's very important to educate practitioners and to give them a way to practice where they don't have to be afraid to treat people. I think it's looking pretty strong. I know that the insurers want to buffer the wording somewhat, and I think that it's appropriate to make things that are flexible and able to get through the legislature. But I think it looks pretty strong. I think it looks pretty good and quite comprehensive. Many states have done one part or the other, and Delaware has the opportunity to do the whole program, which I think can be a model for other states. There are a lot of people in Delaware that are looking for good health care in this regard and haven't been able to find it. So I think that Delaware can really be in the forefront of this disease, and I think that tick-borne illnesses, we're just going to see more and more of a problem if it doesn't get aggressively handled.